Hi, good evening. My name is Manisha Jones, and I am video presenting Unit 4 Case Connections for University of New England Medical Biochemistry. So for this case connection, we had to choose two, and I chose case number 2 and case number 4. With case number 2, it gave you 3 scenarios and it asked about what was the most likely enzyme deficiency, if any amino acid was essential as a result of the deficiency, and also potential vitamin supplements that would be useful for the condition and what steps of the metabolism they could potentially help with. The first scenario was in regards to a full term girl that was born and released, but at 9 days old, they did a screen testing for branch chain amino acids and it came back positive. Decreased branch chain keto acid dehydrogenase enzyme activity is known to be a rare inborn metabolism error called maple syrup urine disease. This disease is responsible for breaking down branch chain amino acids such as leucine, isoleucine, and valine. Maple syrup urine disease occurs due to pathogenic defect in any BCKAD subunit, resulting in elevated branch chain amino acids and their corresponding alpha keto acids. Accumulated BCAA and alpha keto acids manifests as a constellation of clinical symptoms due to dysfunction of the central nervous system, immune system, and skeletal muscle. As the leucine levels increase, the transportation of large neutral amino acids drastically decrease, and due to the amino acid decrease, this leads to a neurotransmitter decrease as well. The goal of treatment for this disease is to address the nutritional needs and manage acute metabolic decompensations. Thiamine, vitamin B1, if supplemental to patient with MSUD is responsive, is encouraged. Leucine is not needed to be supplemented as it is found naturally in breast milk or formula. Valine and isoleucine are supplemented as they are low in content in medical nutrition. The second scenario included a 69-year-old woman who presented with 30-year lower back and large joint pain. She had blue-gray pigmented macules, and due to the symptoms upon presentation, blue-gray pigmented macules on the ears and the sclera, and past aortic stenosis, the diagnosis is consistent with alkaptonuria. Alkaptonuria is an autosomal recessive disorder that results in deficiency of homogentic acid oxidase and in the accumulation of homogentic acid in connective tissue. The excretion of homogentic acid is reduced with dietary restriction of tyrosine and phenylalanine, but little chemical effect has been demonstrated with this treatment. As treatment is limited, tyrosine and phenylalanine can reduce the excretion of homogentic acid with dietary restrictions. The third scenario was a 4-day-old infant that came to the clinic. She weighed 5.9 pounds, and the pregnancy was vaginal. The results from her screening said her phenylalanine was extremely high. So phenylketonuria, also known as phenylalanine hydroxylase deficiency, is an autosomal recessive disorder of phenylalanine metabolism in which especially high phenylalanine concentrations cause brain dysfunction. Phenylalanine, an essential amino acid, is no longer metabolized and broken down into tyrosine. Tyrosine becomes essential as a result of this deficiency. Dietary restriction of phenylalanine has the highest success rate for treatment. The other case that I chose was case number 4. And with case number 4, it talked about a 58-year-old woman who presented with all of these symptoms to the emergency department, and the doctors were suspecting megaloblastic anemia. So if the physician believes that the symptoms of progressive fatigue and weakness, loss of balance, tachycardia, pale junctiva align with a megaloblastic anemia diagnosis. Megaloblastic anemia is a blood disorder that causes the bone marrow to make abnormally large red blood cells. When the body does not get enough vitamin B12, this condition happens. For one's body to function properly, it needs a healthy amount of red blood cells to be able to carry oxygen from the lungs to the tissues and back again. Vitamin B12 is one of the vitamins necessary to help form red blood cells, and when there is not enough in the body, they can produce abnormal cells called megaloblasts. Red blood cells are now not able to divide normally and reproduce. They are too large to be transported into the bloodstream, and they die earlier than normal red blood cells, which reduce the numbers of red blood cells, which cause anemia. Iron deficiency might also be a possible deficiency due to the symptoms of the patient having tingling of the lower extremities, loss of balance, irregular heartbeat, and swollen red tongue with loss of papillae. Vitamin B6 deficiency is associated with microcritic anemia, ECG abnormalities, dermatitis with chiliosis, which is a scaling on the lips and cracks on the corners of the mouth, glossitis, but the deficiency is uncommon. Vitamin B12 and other methyl donors such as pyridoxal 5-phosphates and folate are necessary as coenzymes of methyltransferase and lead to the remethylation of homocysteine to methionine. B12 is also responsible for the conversion of methyl THF to tetrahydrofolate. Both B12 and methyl THF are required for the methylation of homocysteine to methionine, while methionine is critical for the methylation of various biological molecules, including DNA. Low dietary consumption of B12 results in respectively low serum levels, which induce alterations in DNA synthesis. Thus, deficiency of B12 may lead to DNA damage. Potential laboratory testing that could aid in diagnosing the patient would be a complete blood cell count, peripheral blood smear, reticulocyte count, and an iron level test.